What is a modifier in medical billing? In medical billing, modifiers are the coding tools that play a critical role. They help inform and explain the payers regarding the work done by a physician while they're patient. Even a slight mistake or incorrect use can trigger audits and lost revenues. Detailed and correct documentation of a visit should be reported. Types of modifiers in medical billing. There are a number of billing modifiers in medical billing. The key is to know when and when not to use the specific modifier. Using the right modifier can help prevent potential audits and maximize timely payments. These Medicare modifiers are grouped in two. One includes those that are applicable for M services and the other includes the modifiers that are not applicable for M services. Commonly used medical billing modifiers include the following: Modifier 25, 26, 59, 91. This modifier is a coding tool used to indicate an evaluation and management service by the same healthcare provider on the same day when the procedure or other service was performed to the patient. Modifier 25 in medical billing. For example, if a woman walks into a dermatology clinic, the physician performs a complete examination of the skin from her head to toe. This would classify as a regular skin checkup. But if the dermatologist finds any wound or tumor and determines a removal of tissue, it would classify as a separately identifiable M service, and hence, Modifier 25 would be applicable in this scenario. Modifier 25 in medical billing. This modifier identifies the repeated lab tests done for the same patient. The point to remember is that these tests are done on the same day. Modifier 91 implies that the service provided by the healthcare physician of repeated tests was with intent and should be payable. Using a correct modifier is essential in this matter as it may appear duplication of services and can lead to denial. Modifier 59 and Modifier 91 in medical billing are often confused with one another, as 59 also is used for two procedures done on the same day. But there is a difference to be noted, that Modifier 91 can only be appended for laboratory diagnostic tests, whereas Modifier 59 is used for services that are distinctive of one another under the circumstance. For example, a diabetic ketoacidosis patient comes in for potassium replacement and low-dose insulin therapy. Physicians order multiple tests to monitor their potassium levels for the treatment progress on the same date after the initial potassium test. What action is required to do is caller. Verify the received date and denied date of claim, and reason for the denial. If the representative says claim is denied for modifier is inconsistent with the procedure billed, then verify billing history of patient, if any date of service paid with the same procedure and modifier. If we did receive payment for previous date of service, then ask representative to send the claim for reprocess, and get claim number and call reference number. If we did not receive payment for the previous date of service, then verify mailing address for submitting an appeal and get timely filing limit for appeals, and verify claim number and call reference number.